February 19, 1994, 8:15 p.m. Riverside General Hospital, Southern California. Paramedics burst through the double doors of the emergency room. On the gurney lies 31-year-old Gloria Ramirez. She is a mother of two. She has cervical cancer. Her heart is failing. Her breathing is shallow. To the medical staff, this looks like a routine code blue. A desperate fight to save a dying woman. They have done this 1,000 times. But tonight, the routine is about to turn into a nightmare. Within minutes of cutting open her shirt to apply the defibrillator pads, the medical professionals, trained to handle blood, vomit, and trauma, begin to collapse. They don't just feel sick. They suffer seizures. Their limbs go numb. They can't breathe. The patient on the table isn't just dying. She has become a biological weapon. And ground zero is trauma room 1. The team goes to work. Drugs are pushed. The heart is monitored. But almost immediately, the sensory environment in the room shifts. The medical staff notices a smell. It isn't the metallic smell of blood or the antiseptic smell of a hospital. It is described as fruity and garlicky. Like rotten onions mixed with sweet perfume. It is coming from Gloria's mouth. Registered nurse Susan Kane removes Gloria's shirt to place the EKG electrodes. She notices something bizarre. Gloria's torso is covered in an oily sheen. It's not sweat. It's too thick. It's like a film of grease coating her entire body. But there is no time to analyze it. Gloria's blood pressure is crashing. The doctor orders a blood draw. Nurse Kane inserts the needle. She fills the syringe. As she hands the vial to the respiratory therapist, Julie Gorczynski, she notices a new smell. The garlic odor is gone. Now, the blood itself smells like ammonia. Like heavy-duty window cleaner. It is chemically impossible for human blood to smell like ammonia. Nurse Kane feels her face flush. She feels burning heat. She turns to the door and collapses. The first domino has fallen. Respiratory therapist Julie Gorczynski is holding the blood vial. She looks closer. Floating in the blood are strange, manila-colored crystals. They look like shards of glass. Gorczynski's eyes widen. She starts to feel lightheaded. Her legs give out. She leaves the trauma room and sits at a nurse's station. Moments later, she stops breathing. She is seizing. Inside the room, Dr. Humberto Ochoa is trying to revive Gloria. But he suddenly complains of a burning sensation in his lungs. He says the air is thick. The lead doctor passes out. Panic erupts. Someone yells, "There's gas. Get out." This is no longer a hospital. It is a hazmat zone. The Department of Health orders a total evacuation. Trauma room 1 is sealed off. Critical patients, heart attack victims, car crash survivors, are wheeled out into the hospital parking lot. It is a cold February night. Doctors are treating patients on the asphalt, under the streetlights, wearing whatever coats they can find. Inside, a skeleton crew wearing protective gear declares Gloria Ramirez dead at 8:50 p.m. But her body is left alone in the room. No one dares to touch it. The Riverside County hazmat team arrives. They are dressed in moon suits. Level A containment gear. They scour the ER for a gas leak. Sewer gas. Anesthetic leak. They find nothing. The air is clean. The toxicity didn't come from the hospital. It came from the patient. So, what happened? The most accepted theory is a lesson in accidental chemistry. Phase 1, Gloria was likely using a home remedy called DMSO. It's a gel used by athletes to relieve pain. It explains the garlic smell and the oily sheen on her skin. Phase 2, the paramedics gave her pure oxygen in the ambulance. Scientists believe the oxygen combined with the DMSO in her blood to create DMSO2. This compound crystallizes at room temperature. This explains the crystals the nurse saw in the blood vial. Phase 3, the spark. When the blood was drawn, and the defibrillators were charging, the change in temperature and pressure might have converted the crystals into a third substance, dimethyl sulfate. Dimethyl sulfate is a brutal chemical. It is a war gas. It destroys cells on contact. It causes delirium, convulsions, and paralysis. In a 1 in a billion chance. Gloria Ramirez's body had turned into a walking chemical reactor. The scientific theory is fascinating. But Gloria's family didn't buy it. They called it a cover-up. They pointed out that the hospital had a history of violations. And then, there was the autopsy. When the family hired a private pathologist for a second autopsy, they made a shocking discovery. Gloria's heart was missing. Also missing, her liver, her brain, and her kidneys. The county claimed the organs were decomposed or used for testing. The family claimed evidence tampering. How do you prove malpractice when the body has been hollowed out? Rumors spiraled. Some theorists suggested that hospital staff were smuggling methylamine in 4 bags, and accidentally hooked Gloria up to the wrong bag. It sounds like a plot from Breaking Bad. It is highly unlikely, but in the absence of a clear answer, the darkness fills in the gaps. 2 months after her death, Gloria Ramirez was finally buried. She was placed in a hermetically sealed, lead-lined casket. Just in case. The staff didn't escape unscathed. Julie Gorczynski spent 2 weeks in intensive care. She developed avascular necrosis, her bone tissue began to die. She needed knee surgery. This wasn't mass hysteria. The damage was physical. Real. The case of the toxic lady remains a medical anomaly. We like to think of our bodies as biological machines. But fundamentally, we are chemistry. And sometimes, if you mix the wrong elements, the reaction is explosive. This is Dormant Files. Be careful what you put in your body. See you in the next file.